Oh, man. I love that we were just talking for a whole fucking hour.
Yes, we were. That's what
Did not
happens when we don't
record.
see each other for a fucking week and a half.
Literally. Welcome back. Welcome back, everybody. I apologize for the scratchy, weird voice. I am getting over a sickness. So you're going to hear a lot of like during this,
It
and,
just is what it
just
is.
fucking roll with it.
Yep.
Okay. Episode 60.
Yes.
60, dude.
Very good knowing the episode number off the bat. I'm so proud of you.
I wrote it down. I wrote it down, stuff. I can't do this 60. No, I'm just kidding. Yeah, 60. Oh my Lanta, this is exciting. I love it.
Yes.
I'm so excited.
Mhm.
Somebody asked, they were like, "Oh, you have a podcast? How many episodes do you have?" And I was like, "I think we're up to," because it was when we had batched all those episodes. For like 54 to 56 or something. And I was like, "I think we're up to 56 now." And they're like, "Shut up." I was like, soon to be 500.
I
don't know
just told
what
one
we're
of
gonna
my
talk
teenage
about.
clients about it because I was talking about our speech that we're doing for the kids on the
Yeah.
2nd or whatever. And I was like, it's
Yeah.
about our podcast. She's like, wait, what? You have a podcast and you never told me? I was like, I don't know. Like, it's just weird for me. Like,
Yeah.
you can listen if you want to, you know? She was like,
Yes.
you're going to talk to kids about your podcast where you swear? I said, we're not telling them to listen to us. We're talking about like following your dreams.
Following your dreams. And we're talking about our therapy practices too. It's about
Mhm.
entrepreneurship and what you can do.
Mhm.
Thank you, because I was going to email her earlier today just to double check and make sure, because
Sure.
obviously we both book weeks out. So I wanted to make
Yes.
sure and see if there was like, are they going to ask us questions? Do we need to make anything? What should we do?
Mhm.
It's like, do we make like, do we make a poster? I don't know what we do.
I don't know. I've never
Like,
done this before.
I haven't either. And so I figured I have some of my sheets from the talk that I
Mhm.
gave. And so I was like, we just give some of those little coping skills sheets out, and maybe I'll order coping skills from Amazon, like little squishies for the kids, because they love a squishy or a fidget,
Of
right?
course. Yes.
Really. Anyways, back to the episode 60. Today we are going to talk about PTSD, otherwise known as post-traumatic stress disorder. So, post-traumatic stress disorder. And I think we're going to talk a little bit about, excuse me, other stress disorders or trauma-related disorders, right? Because I think that knowing the clients and people that I see, that there has been a big uprising in trauma. And I'm not saying that the traumas aren't real or valid. It doesn't necessarily matter to the clinician or who you're talking to, whether they think the trauma is a valid, those are air quotes, valid trauma or not. It matters what the person, how the person perceived it, right?
Mhm.
So like it could be like the death of someone's animal. Whereas like somebody might be able to be like, what? Like it's just
Yes.
a pet, it's whatever. But it to that person, if it's their world, then that is trauma. So we're going to kind of talk a little bit about those today.
Well, and I think the overall evolution of trauma, right?
Yeah.
Because back in the day, wasn't it like Gulf War syndrome, right? Isn't that what they used to call it? Where it was like just for veterans who experienced war.
But so even before, so in Nam, when Nam happened, so that's kind of like right when we started to really recognize what trauma was, because veterans were coming back from the war and they were having like hallucinations and dissociations, and they were getting diagnosed with schizophrenia.
Oh, wow. I didn't know that.
Yeah, before they recognized, and they would institutionalize them.
Yikes.
They wouldn't fix them.
They didn't understand the effect that war had on people.
That trauma can have, right? That it changes your brain, that you get stuck in that fight, flight, freeze, fawn responses. And so they had characterized it as like schizophrenia or like hallucinations or psychosis and things like that, and then locked people away when they had institutions. And so now then they started to, so Dr. Vessel
Vander Kolk?
It's like
Basil Vander Kolk, right?
I gotta look now.
I think it is.
I should know because I listened to this book for 17 hours on Audible.
I think it's Basil Vander Kolk. Kolk?
Bessel Vander Kolk, MD.
Yes.
So he wrote the body keeps score, brain, mind, and body in the healing of trauma. So he wrote about like the origins of trauma and like how it got started and whatnot. And I don't know if it was called Gulf War syndrome, but it was something very similar to that when the trauma had first started coming about. But then they petitioned to have it entered into the DSM as like post-traumatic stress disorder and things like that. And to really start recognizing trauma for what it was, because when he started doing different like trauma related modes of therapy with them, then they started to recover. Whereas like somebody with schizophrenia or psychosis, it's not that you don't necessarily recover. You learn how to do reality testing and grounding to recognize what's real and what's not real, like what your brain is creating.
But also those things don't go away. Not that trauma goes away, right? But like you're in the thick of it.
You can fully recover from trauma. You can, like you literally, you can have a severely debilitating thing happen to you or have experienced that and then return to life as it was, depending on what the trauma was, you know, because like if it's a loss of a loved one, obviously it's not going to be life as it was. We're not bringing that person back, but you absolutely can continue to live a fulfilling life. Whereas not that somebody with schizophrenia or psychosis can't, but it's they will always have to take a medication to help regulate their thoughts and that chemistry in their brain. So trauma, let's start with PTSD, shall we?
Yes.
We have, Steph and I were looking in the DSM, which is the Diagnostic Statistical Manual, which is what governs therapists, right? And psychologists and everybody under our field of how we go about diagnosing people. So it's not that we're going to read through the criteria of these different things, because we, again, by no means are diagnosing or giving the tools for anybody to diagnose themselves. That is not your job. Unless you're a trained professional, that is not your job, nor should you be attempting to diagnose yourself, even if you are a trained professional. It's not that Steph and I are diagnosing ourselves. Like, I literally went to somebody and got my ADHD diagnosis. So please, again, trained professional. But the difference in an adjustment disorder, acute stress disorder, and post-traumatic stress disorder, a lot of the times is timeline.
Yes.
So adjustment disorder is what it was termed to me in the very beginning of my diagnosing career was kind of like a catch-all, right? Like this is the diagnosis that you can slap onto somebody while you're figuring out for insurance purposes what their diagnosis is going to be. Not that, and when I say slap onto somebody, it's because insurances prompt us therapists to make diagnoses immediately.
And I was going to say, if you ever have gone to therapy and you're under the impression that you don't have a diagnosis, that is incorrect.
Unless you're seeing somebody like Steph and I who we are not. So Steph and I are not governed by insurances. So we don't technically have to give you a diagnosis.
Sure.
Like we are in our mind and we definitely do share it with you. But if you don't want that like written down or whatnot, because a lot of people, a lot of people don't like the label, right? They get really hung up on that. And so that's what I'm speaking to right now. Not necessarily somebody who doesn't want it on like their medical record, if for some reason they're going into the military or something, because then I would be more careful as whether I chose to see them or not, depending, because I'm ethically, if I think that it's something that needs to be discussed or reported, then I'm going to do it, period. I understand that maybe you don't like that or don't want that, but like other lives could be at stake if I'm not reporting the correct information. So,
I just had a lot of people that are like, no, they never told me a diagnosis, or no, I don't really have one. And I'm like,
Yes, I've had that a lot. I've definitely had that a lot. So they're the two schools, right? If you're seeing somebody under your insurance, you definitely have a diagnosis. You have to.
We wouldn't get paid for services if we did not give a diagnosis.
Exactly. So this is the adjustment disorder. What I'm talking about when I say slap it on somebody is the sense of it's a very, it can catch a lot of different symptomology, right? So like you could have gotten into a car accident and you could be really anxious, but like you could still drive and like function somewhat as normal, but like you're still super anxious about it. So I'm not necessarily going to diagnose you with anxiety, like GAD, which is generalized anxiety disorder, or like, chronic anxiety disorder. I'm not necessarily going to diagnose you with like a trauma disorder, because if you're not fitting the symptomology or the criteria, like it doesn't, I'm not going to put that on you. But an adjustment disorder really does catch everything. It's just like a stressor, can be of any severity and perceived, or your perception of severity. It doesn't have to be, it could be something as like, somebody punched me in the face at the supermarket, or like,
I mean, it could be like a literal breakup, moving from high school to college, your parents getting a divorce, right? Like a fallout with friends, right? It really does encompass a lot, and it gives the clinician enough time to investigate and ask more questions and determine timelines in order to give you a more confirmed diagnosis. Not that an adjustment disorder is not relevant. It is, but also you can't keep an adjustment disorder forever because there's timelines.
Yep. So you've got to then, usually it's what I would do if somebody's coming to me for trauma, is I'm going to be looking at an adjustment disorder depending on like what they've got going on, and then keep asking the questions that I need to ask that I can't ask in the 60 minutes that I'm given to make this. So then moving on to acute stress disorder. So this is anywhere from it's like mixed up. It says like either like 4 days or 6 days and then up to the 4 weeks. So this is where something stressful has happened and you're seeing like, so say you got into a car accident and you're starting to have some of these symptoms where you're really nervous about driving, afraid to get in,
having nightmares about what happened.
Nightmares, like that shock response when a car gets too close, of like, freaking out. And it's when that trauma happens within those symptoms show up in those 4 weeks and are resolved in those 4 weeks. So sometimes traumatic things happen to us and our brain gets really, it gets out of whack in the beginning for a little bit, but then is able to process and understand what happened and make sense of it and continue to move on. So I think like this could have happened I feel like this happened with my cat, Joe, dying. I really, really do. Like he was with me for 10 years. He went in, not a traumatic way, but like basically died a year after my first cat died of like a broken heart. But he was completely fine. And then he just stopped eating, stopped everything. So, and I just remember being distraught for like a week and a half, 2 weeks. And then like, as time passed and as I like talked about it with friends and family and like started to understand, and then I got Zeus. So like also not super healthy, but replaced him, not literally, but you know what I'm saying?
Yeah.
So was able to focus my attention on something else. I was able to move through it. Right. So again, the sadness, the flashbacks, the anxiety, avoidance of symptoms or triggers or any of those things, if it within these 4 weeks, it happens and then resolves itself. So that would be our acute stress disorder.
The other thing to note that I will say is that it's not just you experiencing the traumatic event. It could be you witnessing it or somebody close to you experiencing something. So when my dad got in that bad accident, that fucked me up for a while. I was constantly worried about him. And so it can be, something of that nature as well.
Absolutely. Absolutely. And again, it doesn't have to be real. It can be an imagined attack on your personal safety or threat to your life, right? It doesn't, and so not in the sense of like, well, I had a dream and I imagined someone was killing me, but like, so where you got into a car accident and you really felt like you were going to die. Sure. You didn't die, but you really felt like it. Like that counts. So then if we move then to the next higher level up, it would be the post-traumatic stress disorder, commonly referred to as PTSD. So this is where the experience witnessed, where it was involved in, where there was like threatened death or just experienced an intense fear, helplessness, or horror. So with kids, it's going to look more like disorganized behavior or chaotic behavior too. That's how it shows up for children.
A lot like ADHD, actually.
Yeah, a lot like ADHD.
They're hypervigilant, so they appear hyper because they're always on edge, like looking around everywhere.
Having to move, fidget, do all those things. Yep, having to like constantly attempting to avoid those symptoms. Absolutely. Like he did talk about that. Bessel talked about that in his book. Like kids of alcoholics, whose parents were alcoholics and never knowing what was going to be coming next, and like that, them getting misdiagnosed in school.
Yep.
So post-traumatic stress disorder then I think is at the 3-month mark afterwards and then continues on.
It's pretty persistent. Yeah.
Pretty persistent. So in those 4 weeks, those symptoms haven't resolved. We're moving from acute stress disorder to post-traumatic stress disorder. And then there's specifiers with post-traumatic stress disorder. So just like an anxiety disorder or depression disorder. So like depression isn't just like, oh, you're depressed. It's major depressive disorder.
And it's mild, moderate, or severe.
So there are different specifications as to what's going on. So when people hear major depressive disorder, they're usually like, oh, I'm not really depressed. And it's like, no, that's just what it is in the book. We don't make the rules. So there's specifiers to tell us of like, it's okay. You know, I mean, their life is a little messed up and they're not too happy. And then it's like, oh, it's affecting some things, kind of hard for them to go to work or school. And then it's like, oh shit. Yeah. They can't get out of bed. They're not showering. Same goes with this trauma disorder. So for PTSD, there is an acute, a chronic, and then with delayed onset. So acute is if the duration or symptoms is less than 3 months. And then chronic is if the duration of symptoms is 3 months or more. And then delayed onset is at least the symptoms starting 6 months after the trauma has happened. Sometimes your brain is continuing to live in this fight or flight, like shock mode, and adrenaline keeps you going for that time. And then eventually when enough time has passed and your brain settles, it starts to recognize what happened. And then it's like, oh shit, I'm not okay.
So do you also think that avoidance plays a part in that too? If you're a person that already avoids feeling your feelings and something traumatic happens and you just like shut it out or put it in a box and you don't open it up again, but then like 6 months later something triggers you and then it comes flooding back, like do you think that plays a part?
Well, and so then do we call that avoidance or do we call that what is the thing where you push it away? Not avoidance. Suppressed memories. So is that like, because that's both like avoidance. Yeah, sure, you can do your best to play, but you're still gonna have to play around and not be around those triggers or symptoms, but you're still going to have that hypervigilance, anxious feeling about like, what if I can't avoid it, at this party, or what if I can't avoid blah, blah, blah. Like with a repressed memory or a suppressed memory, like you don't really, like your brain just locks and files that away and you have no idea that it really happened until your brain feels safe enough and then lets it out. So that's what happens common or often in EMDR is a lot of people they have bits and pieces of the fragment of that memory and it bothers them and it's upsetting to them, but they can't put the whole memory together. Sure. So sometimes EMDR gives you all those memories back, gives you the full memory, puts it together, and then we reprocess it all, if that makes sense.
Yeah.
Don't let those statements scare you. I understand that it may seem scary, like, oh my God, I'm going to do EMDR and all my memories are going to come flooding back. That's not how it works. You're still very much so in the present day, safe with a therapist reprocessing memories. And again, you went to that therapist to be able to work through that trauma. And you're going to get that full memory back sometimes to reprocess it. But then that just means you're going to lose that emotional pull that much faster.
Sure.
So, some of the things that are interesting to me. So for the PTSD or the traumatic event is just the different symptoms that can come with it of like being like struggling to fall asleep, difficulty staying asleep. And it's not even so much so that you're having nightmares, just that your body is on that constant high alert, having that adrenaline pulsing through. So it's so hard for you to calm down. And then sometimes the repressed memories too, of like you not even having the full memory or not even knowing that it had happened. I think that is so interesting that our brains do that.
I think I can't tell if that's thunder or the lady upstairs. Sorry, that's like totally threw me off just now. I was like, is she rolling a bowling ball? What the fuck is happening up there? Is it like legit rain?
Thunder. It is raining. Yeah.
I think sometimes people get caught up in knowing their triggers, right? I think in some instances it's evident what some triggers are, right? Like you obviously know if you were in a car accident, it would be triggering to get into a car for a lot of people, right? But if something happened to where you were confused as to whether or not something was traumatic, identifying the triggers could also be generally very confusing. And then you may feel on edge all the time and not know where to begin. Does that make sense?
Oh, absolutely. Absolutely. I think what I love to have people do is to get like one of those like little pocket notebooks and keep like a pen with them, and then keep that either in your purse or back pocket, or like do it on I mean, you don't necessarily have to do the pen and paper. I just prefer that for therapy purposes because it's creating that mental like brain to body connection. But you can do it on your phone as well and start to recognize, I was driving past this street and I felt, this, or like every time I see the color orange, it's really upsetting to me, or, I really don't like this smell. And starting to write those things down so then you can have one that information for your therapist, because that's going to be helpful. It's helpful for me to know what people's triggers are, and like because there's certain things in EMDR that you can do. Resource installation. So like if you need like for flying, so at the second part of the EMDR training, I was really worried. I mean, I hate flying. Everybody knows. I think I've talked about it enough. But you can do this resource installation where you think you like assign a thing or a person or a object, and attach healthy words to it, like healthy coping words to it. So like mine was like an owl and courage. And so like, then you go through like, you know, imagining this visualization of like, I'm on this owl and I'm flying through the air, and like I'm noticing the ups and downs, and like I'm coping well with it, and blah, 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 and use bilateral stimulation with that as well. And it felt really good while doing it. It really, really did. And I think if I would continue with it, that maybe I wouldn't be as triggered as I am flying. But like also it's getting better. Like the more that I fly, I'm getting used to it. I'm not going to say it's my favorite thing or that I like it, but the more that I'm going on vacations, the more that I'm starting to be like, okay, just like exposure therapy, right? Sure. Of like, okay, this was fine. Okay, this was fine too. And this was fine. So they have things like that too. But again, if you're not writing those moments down, like we don't know like what you might need help with. But then also too, it's helpful to know what your triggers are. So then you can start to have things, to avoid them. Like, so for somebody who might have been raised without access to food or like running water, maybe like, you know, it's the joke of like the emotional support water bottle, but sometimes that really is something for somebody of like, you know, where maybe they were kidnapped and they were kept without water or food. Like having those things on you is keeping those triggers at bay. It's like I am meeting my needs, and I can show myself that I'm meeting my needs, and that I don't need to be afraid of not having these things because there's access to them. And sure, that might be a drastic experience, right? Like I don't know anybody who was kidnapped, but I'm just saying it for purposes of an example. Does that make sense? So go ahead.
No, I was just gonna say, go ahead.
So then I think once you start to identify those triggers and the things that are upsetting to you, you can bring those to a therapist and start working on them, right? To really start to understand, because ultimately what it comes down to when you have been through trauma or witnessed trauma or, you know, have these perceived traumas, it was a moment in time where you weren't feeling safe. And the purpose of a therapist is to help you feel safe, help you to recognize that you are safe, you are in control. You can leave any situation that you don't want to be in. So I really, when we had posed the question on my Facebook about like, what do we need to talk about? And people were talking about PTSD and like triggers and how to cope with them. Realistically, there's so many different ways to cope. I mean, any mode of therapy is going to have their own way of coping. Sure. Steph and I have talked about coping skills a lot on our podcast, but again, just to review some of them that we talked about, what episode was it where we talked about the stop skill?
It was recently. I don't remember.
I don't either. It was 54 to 56. I'm almost positive. So we talked about the stop skill where it was like taking a break.
That was talking about not taking your moods out on other people.
Oh, so then like, it was 57 or 58. It was
like taking a beat. I think that one comes out in the next. It comes out next month.
Yes. So that one's coming out soon. Obviously it will be out before this. So you're already going to hear it.
Yep.
But it talks about like, so the stop. So it's like taking a step back. It's stopping, taking a step back, observing, and then proceeding with caution. Being able to, we talked about how breathing is so fucking huge. And not just to try breathing exercises when you're in the midst of a crisis. You need to, in order to build up the breathing that helps regulate your nervous system, it has to be something that is consistent, and it has to be like belly breathing. Like, so yoga is huge. It teaches you how to breathe with your belly instead of just these short, shallow chest breaths, which then can create hyperventilation.
Well, and grounding and mindfulness, right? Like we have to be back in our body, because if you're experiencing something like a traumatic trigger or a flashback, you are convinced that you are back in that situation, and you need to know like reality testing of like, I'm not there right now. I'm okay. I feel my feet on the ground. I can hear Mari's voice in front of me. Like I'm okay. And yes, that takes effort and it takes work, because if you're just going to stay stuck, and that's not to sound offensive, but if you're going to stay stuck in that situation, you're not ever going to feel like you can get out. you have to be able to tell your brain like, no, I'm okay, I'm safe, and this is how I know that I'm okay and I'm safe.
I have a lot of times when they talked about it in the EMDR certification, a lot of times it's like, look at your hand and what does your hand look like? Does your hand look like 5-year-old you, or does your hand look like you now? And so then being able to look at your feet, okay, what do your feet look like? Do they look like your shoes that you're wearing today, or do they look like the shoes that you were wearing when you were raped, or
Sure.
whatever it may be? A lot of people think too that it has to be some drastic big thing that happens to you for trauma. And like, again, I just want to reiterate that it doesn't have to be a giant car accident or a rape or a molestation or something like that. It can be something, not that this isn't as severe as those things, but people think it has to be this forceful, jarring thing that happens, where it can be this sustained trauma of like infertility. Going through those treatments and going through hearing, different doctor's appointments where you're not getting the answers that you want, that over and over and over again, that's a repeat trauma, that's sustained trauma. So like, people also should understand that verbal abuse can turn into trauma because it's this repeated sustained event.
Or neglect. Like, neglect isn't physical abuse, but it is still abuse.
Yes.
It's very much still abuse, and it affects the way your brain develops and how you interpret situations and how you live in the world and how you see the world. And I think people forget about that, right? When we're taught as mandated reporters what we call and report, neglect's often on the back burner. And it's like, no, dude, if this kid's needs aren't being met, if he's not being fed and he's being sent to school without shoes and socks, like, that shit happens.
Oh, all the time. I can't tell you how many times I reported neglect at the hospital we used to work at, and then it would just get screened out.
Yep. So what emotional abuse, to be honest?
Yeah, absolutely. And then as people in a helping profession, and not just us, so like nurses, doctors, dentists, anybody, that they also go through that secondary trauma or vicarious trauma. So like, also understanding too that sitting and listening to people's traumatic stories all day, or like experiencing traumatic events at work, of like someone coming in with a broken leg and they're just screaming and all of those
Somebody
things.
coming to work with a weapon.
Yeah.
Oh, yeah. Kids beating the shit out of you every day.
Yeah.
Or having to put a little kid in a hold. Like,
that's
not easy. And I will tell you right now, before I had my son, not that holds were easy, but after I had him, they were a lot fucking harder, because these kids would cry for their mom. And I'm like, I can't, I'm out. Somebody's got to switch with me. I can't do it. I can't. Like, I know that I'm doing this to keep him safe, and I'm not doing it because I'm trying to hurt him, obviously, but there was that shit pulled on your heartstrings.
Yeah, it was definitely hard. Definitely hard. So hopefully this has brought about an understanding of what PTSD is, and potentially how to deal with some of the symptoms. But again, I think this episode could be 2 to 3 hours long if we talked about how to manage those symptoms, right? If you listen to any of our episodes about stress, about how not to project your emotions out onto loved ones, any of our cognitive error episodes too, that is also like changing the way that your brain is thinking, which definitely happens when you experience a traumatic event. You start to operate in that fear of, I'm not safe, I'm not okay, which just isn't necessarily accurate depending on the situation that you were in versus the situation you're in now. So there are many different ways and therapies to deal with trauma. So we'll just kind of end on that. You can do EMDR, which is eye movement desensitization and reprocessing. You can do EFT, which is emotional freedom tapping. Is that what it is? Yeah, emotional freedom technique. So they do tapping. So it's somewhat of the same understanding of EMDR, which is using the bilateral stimulation, but it's just a different way to do it. There is internal family systems theory, which I think is phenomenal and is the next thing that I would love to be trained in. After listening to it in The Body Keeps Score, that book, towards the end, he talks about different modes of therapy that you can use, and internal family systems is in there, and it sounds so good. You can do rational emotive behavioral therapy. It was a little confusing for Steph and I, because we were like, oh,
just because that lady was a terrible presenter. But I also think DBT plays a huge role, and that's like the primary practice that Mari and I use, because what can happen with trauma is that it can develop into other issues for you that DBT can then correct.
Correct. So basically what we're talking about is sometimes BPD, so borderline personality disorder, can come out of trauma, or the way that you felt you had to operate in your situation and or your life to make it, to survive, depending on what was going on. And so we're going to talk more about borderline personality disorder, but DBT is a proven method to be able to help. I hate the word cure.
Well, it doesn't cure it. You learn to cope with it, and you change your way of thoughts.
Yes.
Yeah. You start to perceive the world differently.
Yes, to change your view on the world due to it being inaccurate because of the way that you were maybe raised or what you experienced, and then how it gets stuck in that track in your mind. So
ultimately what we're saying is like seek a professional if you're struggling.
You have to. Yes.
You can't do this on your own. You're not expected to do this on your own.
And that is the one thing that I will say about, like, so depression or anxiety, or maybe some of maybe the diagnoses that I would consider like lower level. I'm not dismissing the fact that people are going through things or experiencing things, but sometimes those different mental disorders, you can maybe do this on your own. Maybe you can't, right? Maybe you can work through that on your own. Trauma is a different beast all in and of itself, because of the way that it changes how your brain is functioning. So it is extremely important to be able to see a professional, because if you are being diagnosed with a trauma disorder, then it would be helpful to have somebody else there to help facilitate these different modes of therapy to be able to help you through this. Because it doesn't, you can recover. It does not have to be where, well, this is my life now and this is how I experience it. This fear, this anxiety, this, always feeling like I have to check, someone's on my back, or I got to, do all these different locks, because basically PTSD is a gateway to all of these other diagnoses. Developing compulsions into some of the compulsions from some of the anxieties that you have that are surrounding the trauma. Like, so with seizures, like me and my compulsion was starting to develop, like, are you okay? Are you okay? Are you okay? I'm like asking every 45 fucking seconds. It's so stupid. Now that I look back, I look back, right, and think about it. But like in the moment, I was like, I have to ask.
Yes. Otherwise something bad's going to happen. Yeah.
If I don't ask, then she is going to be in her room seizing. Whereas like now I'm like, Mario, honey, it's not how that works. Like, you asking doesn't prevent the seizure. So yes, so hopefully this was helpful. I love trauma, so if you guys need anyone, I'm your girl. I love it. People are like, you love that people have been through really negative things, and I'm like, no, I love helping them know that they don't have to feel that way the rest of their life.
For sure.
So you can find Steph at SpookyFitMom13. You can find me at BEA_XO11. We are at Rewriting Her Story Podcast, all on Instagram. You can email us any questions, concerns, comments at rewritingherstorypodcast@gmail.com. And we are Rewriting Her Story Podcast on YouTube. Like, share, subscribe to anything, to literally anything. Followers on Spotify or Apple Music. You can on Instagram, like things, comment. We love it. We love to see it.
Yes.
Until next time.
Bye.